Hi everybody, this is your preview for the material on next week's exam, which is the cardiovascular system. Hopefully you have in front of you a copy of the cardiovascular system handout that you can see here. I'm going to be running through it with you, and it would be helpful if you also had your book in front of you, because at this point I'm unable to display the images in this book with any clarity. So let's take a look together at what I expect you to know for next week's exam, the cardiovascular system. First off, page 142 of the 5th edition of our medical terminology book has a lovely little picture, I'll highlight that there, of a heart. I want you to be able to label that heart. So there are a couple important parts to it, and I want you to know them. There will be a labeling on a diagram just like this on your next exam next week. Also, there is going to be a multiple point question, so many points, not multiple choice, multiple point question related to the path of blood through the heart. And I've outlined it below. You can see here. You have the superior and inferior vena cava where blood is coming into the heart, and then it's going to enter the right atrium, move through the tricuspid valve to the right ventricle. Then it's going to move from the right ventricle to the pulmonary valve, out to the pulmonary arteries and to the lungs. From the lungs, it's going to return to the heart on the pulmonary veins, enter through the left atrium, travel through the bicuspid valve, and then through down to the left ventricle. If you have that picture out in front of you, you could be following along right now. After it leaves the left ventricle, it will go through the aortic valve and out the aorta to the body tissues. Now please note that if you are following on this little flowchart that I've got here, some of the words are italicized and some of them aren't. The italicized words are those that contain deoxygenated blood and those that contain oxygenated blood. One of the weird things here in the heart is that we actually have arteries that have deoxygenated blood and veins that have oxygenated blood. And in every other instance in the body, that's not the way it works. But technically, by definition, an artery is just a vessel that leaves the heart. So the pulmonary arteries, which are leaving from the right ventricle to the lungs, are leaving the heart and going to the lungs. They contain deoxygenated blood. And the pulmonary veins return to the heart because veins are just technically vessels that return to the heart. So they're coming in from the lungs with oxygenated blood to the left atrium and returning that blood to the heart. So pay attention to that. It can be a little tricky. You don't have to know the conduction system of the heart on page 145, so all the different nodes that the electricity travels through. I'll let Dr. DeRocher handle that. Or the waves of the ECG. Also, I'm not going to ask about specific arteries or veins. So let's just take a look. If you've got your book, we have the heart in front of us. There are a couple different pieces to the heart or parts to the heart, the structure. If you look at a cross section, you have the epicardium, which is the outermost layer. It's actually the visceral pericardium, so it's the same thing. Then you have the myocardium, which is really thick, and the endocardium on the inside. The two epicardium and endocardiums are actually connective tissues. They're very smooth and slippery, so the heart can move blood through it and contract in that cavity without friction. The myocardium is very thick muscle, cardiac muscle. And if you look at the heart and compare the right and the left ventricle is much thicker than the right, and that's because it has to squeeze all of that blood to the aorta, which is going to the body. The right ventricle is just sending the blood to the heart, to the lungs, so it's not going to need quite as much force behind it. So there's a thickness, and that will help you identify those parts of the heart too. Look for the thick wall, you know you're on the left side, because it might look a little funny if you're looking at it on the paper. Left looks like our right, and right looks like our left, but that's because, you know, we're talking anatomical position when we give it left and right designations. So pay attention to that as well. In terms of arteries versus, the chambers are at the very top. We have the atria, which are thin-walled, and the ventricles, which are on the bottom. They're thicker walls. And there are valves in between, as you saw in that path of blood through the heart. We have the tricuspid and bicuspid valve, which are also called the atrioventricular valves. You should know that. They are AV valves because they're between the atria and the ventricles. Also, the pulmonary and aortic valves are known as semi-lunar valves. They must look somehow like a moon, which is why they got their name. I don't really know. In terms of arteries and veins, the arteries are thicker, and that's because they're taking a lot of pressure because the blood within them is coming from the heart and the force behind it is pretty great. So their musculature surrounding the wall is a little bit larger. They have a smaller diameter for that reason as well. Their lumen is smaller. They don't have any valves in them, and they always carry blood away from the heart. They are very crucial in maintaining blood pressure because we have that muscular part to it. We can vasodilate and vasoconstrict it and change the blood pressure. So really crucial little things. The veins, on the other hand, don't have as much smooth muscle. They have a much wider lumen, and they also have valves in them. And what happens is as the blood is flowing through the veins back to the heart, it will travel and then sort of slosh backwards, and we don't want the blood to pool all the way down to the feet. And so we put a valve in that vein, so if the blood does kind of flow backwards for a minute, it gets trapped by the valve, and then the next time your heart beats, the blood will continue on its way. So you'll see that valve in veins only, not arteries. And they are carrying blood towards the heart, obviously. Now, key pathology that you should be aware of, I have down here at the bottom. Just a few things that you probably know of, but maybe don't know the technical terms for. So bradycardia and tachycardia are opposite each other. Bradycardia is a depressed heart rate, so lower, and tachycardia is an increased or elevated heart rate. Cardiac arrest means complete stoppage of heart activity. So if people are having a myocardial infarction, that generally they're also in cardiac arrest. It means the heart is not contracting as it should. Congestive heart failure often is a result of a heart attack. If you have heart muscle that dies, it doesn't regenerate. So you will have scar tissue put in place of that heart muscle tissue. And when that happens, that scar tissue doesn't function like heart muscle tissue. And so you will have a decrease in the ability of the heart to pump blood. And this can lead to congestive heart failure. You have fluid that will accumulate within the tissues and around the heart, and it can build up over time. So it happens pretty often when you have a relatively severe heart attack, or one that at least damages the left ventricle because it has such an important role in heart functioning. Coronary artery disease is just a generic term for having insufficient blood supply to the heart muscle for whatever reason. You know, it could be artery blockage or something along those sorts. It could be something else. Fibrillation is when the heart quivers. Normally the heart will beat very rhythmically, but in cardiac arrest, it doesn't do that. It actually kind of shakes. And when it shakes, it doesn't pump blood efficiently. And so that's why you see defibrillators, those two paddles that they use to shock people. What they're actually doing is they're stopping all the electrical activity in the heart and hoping that the electrical pacemakers of the heart will pick up the rhythm again in a normal way so the heart will continue to beat. If you've ever seen that on TV, they talk about, stand clear of this patient as they're shocking them, and that's because the electricity they're putting in could travel through to anybody who's in contact with them. So it's an interesting thing. As I said already, myocardial infarction, or MI, is a heart attack. An aneurysm is when you have an artery that is weak, and as the blood flows through, it actually balloons out at that point, and the danger is that it can rupture and cause pretty severe issues. Stroke can be a result of an aneurysm if it happens in the brain. Other things can result, but it's a weakening of the artery and a loss of blood because of that. Hypertension is another word for high blood pressure, and atherosclerosis just refers to hardening of the arteries. Oftentimes we associate it with a buildup of plaque on the arteries, but not always. There can be other things that cause atherosclerosis. So hopefully this gives you a little preview as to what we're looking for next week. If you have any questions, you know where to find me. Keep posted on your emails because I'll be sending you a few coming up soon. So have a wonderful day.